Go live.
Good afternoon, doctors. On behalf of Hetero Healthcare, I, Dr. Prashant, welcome you to this webinar on Carbetocin in action. Doctors, as you know, at Hetero, we market products in different therapy areas like in gynecology, orthopedics, dermatology. We have a very strong R&D support and we have developed many unique formulations, keeping patient benefit in mind. Like we have got NSAID patches, we have got patches even of lactic acid. Recently, we have introduced Carbetocin. Carbetocin, as we all know, is used for prophylactic management of PPH. PPH we know is a condition which can lead to which can lead to disaster. While there are several paper and guidelines which suggest use of Carbetocin, today for our clinical insights we have got eminent speakers to give their experience and to share their experience with Carbetocin. We welcome Dr. Shashi Shrivastava and Dr. Sarla Jain. Dr. Sarla Jain is MBBS DGO CAMS from Vienna, CIMP, FICOG. Madam is private practice since 40 years, life member APMP, FOXY, IMS, ISAR, PCOS, AMPOG, past secretary Bhopal Menopause Society, now president Bhopal Menopause Society 2021-22. Madam is organizing secretary West Zone Conference of IMS in 2019. The next speaker is Dr. Shashi Shrivastava. Madam is MBBS DGO FICOG CIMP, Director of Saurabh Nursing Home and Specialty Medical Clinics, past president of Bhopal Menopause Society, life member of Indian Menopause Society, PCOS and FOXY. Welcome, Dr. Jain. Welcome, Dr. Srivastava, to this meeting. Now, over to you, both of you, for your clinical insights. Thank you.
Thank you, Dr. Prashant.
Thank you for the kind words. Welcome you all.
Good afternoon, everybody.
Yeah.
I am sharing some cases for injection Carbetocin we have used in some cases. This first slide, showing first slide, case 1, patient Mrs. XYZ, aged 24 years, primigravida, with no high risk factor. She went into labor at 38 weeks of gestation, admitted in 4 centimeter cervical dilatation. She went into normal progress of labor. At the time of crowning of the head, staff nurse given injection Carbetocin IV 1 mq. After expulsion of the placenta, uterus was well contracted and there was no PPH with no side effect. So we have no need to give an oxytocin in this case. Next case.
Another case, we have the Mrs. Poonam, a 34-year multipara with a history of G4, P3, L1, A0, all female child. She is admitted in labor pains with full dilatation of cervix, with history of GDM in this pregnancy, large size baby in last pregnancy. The normal parameters and routine investigations are normal except little apprehension for the sex of the baby. She delivered again fourth female child of 3.7 kg. My nursing staff given injection Carbetocin intramuscularly at the time of delivery of the child. Uterus was well contracted and there is no PPH even after the 6 hours of delivery. This shows little apprehension, and sometimes due to again the female child, they were worried about the sex and their family member also having some problems. So they develop PPH later on also. So it controlled the patient for at least 6 hours. We need not to worry after giving intramuscularly. Next slide.
Case 3, Mrs. Meena, aged 30 years, with history of PIH in last pregnancy, delivered male child at government hospital normally. With history of PPH and 2-unit blood transfusion was given. Now she is coming for regular antenatal checkup. Routine investigation, RFT and LFT are normal. At 12 weeks, anti-scan was done, which was normal with prediction of high risk for eclampsia. She was on aspirin 150 HS, but developed hypertension at 32 weeks. She was on tablet Levitalol 100 milligram BD. She was admitted with labor pains. Blood pressure was 140 upon 100. Cervical dilatation 6 centimeter. Augmentation done by injection oxytocin 5 units in drip. After 1.5 hours, she delivered healthy male child. IV injection carbetocin prophylactically given. Her vitals are stable, no raise in blood pressure and no PPH. So it is seen then effect of carbetocin is very good in these cases also.
Another case, Mrs. Tripathi, 22-year young female, referred for full-term pregnancy with anemia, with hemoglobin of 7 gram %. In spite of parental iron therapy, she is not able to raise her hemoglobin. She was found beta thalassemia trait was positive. Her husband was normal. Advised blood transfusion, but she came with labor pains with cervical dilatation of 8 centimeter. She delivered normal male child. Injection IV carbetocin was used. There was no PPH. Postnatally, though, we have given blood transfusion later on. So in cases of anemia, where we are worried about the little loss of blood also, so this injection carbetocin is work wonder. It is a really good drug for preventing the PPH. Next, please.
Mrs. Meena, 30-year primey with twin pregnancy, dichorionic, diamniotic. Routine investigations was normal. Elective section was planned. After delivery of both child, in this case, after delivery of both child, IV uterus was well contracted and there was no PPH and placenta expelled very good.
So in cases of twin pregnancy, there is also good results with the carbetocin. Another case, Mrs. Rita, 25-year patient, admitted in full dilatation with history of trial of labor for last 1 day. Immediately, we have took her for the C-section. Meconium stained male child was delivered and injection carbetocin was given. She had mild PPH, which was well controlled by IV 10-unit injection oxytocin. So when the atony occur, when the carbetocin doesn't work primarily to prevent PPH, we can also use oxytocin. Just in this case, we have used oxytocin to minimize the further delay and manage the PPH. Thank you.
Thank you for the makers of Carbi.
Thank you for your clinical insights. One thing is very interesting, that 1-2 patients were definitely high-risk patients with twin labor and past history. Even they were given carbetocin and there was no incidence of PPH. Only one patient, despite giving carbetocin, did develop PPH, and then we had to put the patient on oxytocin. There are some questions which I'll share with you.
Okay.
Sachin, we can go to the next slide. Yes, Sachin? These are the cases that you have shown, but otherwise, what is your experience using carbetocin? Routinely, I'm asking, or you keep carbetocin as a prophylactic for some reserved cases?
We are using carbetocin in selected cases, not
selected
in every
cases.
case.
Not. And what are those selected cases?
High-risk pregnancy. Just like yesterday, I am using eclampsia also
Correct.
prophylactically. In previous history of PPH, in this also we have used prophylactically.
But I am using regularly in all cases.
Okay.
Because the prevention is better than cure.
Yeah.
And
sometimes despite
PPH
all
is
this,
a very nightmare for us.
that I completely agree, madam, because these
So
are
I'm
people.
using regularly instead of methergine. Now I am
Yeah.
start using carbetocin regular basis.
Regularly. That's very good.
Yeah,
And especially in uterine atony, which could be because of fibroids, which could be because of twins, or which could be even because of a delayed labor. I mean, carbetocin would definitely help in your experience, madam, between carbetocin and oxygen. When we say carbetocin, it works better. Is it that the frequency of contraction is more, or the intensity of contraction is more, or both?
both,
Both, no?
both are
So,
there.
exactly. So we have got more contractions and we have got more frequent contractions, which leads to expansion of placenta and contraction of uterus, etc.
Yes.
Right, madam. Thank you. The next question, Sachin. What is patient profile where you can you anticipate PPH to begin with, first of all, or you expect PPH in every patient? Anything can happen.
PPH may happen in any case, but some
Exactly.
of them are high risk as a female pregnancy, fibroid, previous
Hmm.
history of PPH,
PPH.
severe anemia, or prolonged labor, large size of baby,
Okay.
multiple pregnancies,
Pregnancies.
multiple pregnancies.
Are patients of diabetes also more prone for PPH? Any connection? Or
Yeah, most probably maybe due to large size of baby.
yeah. And maybe the contractions may not be so strong in diabetes. We do not know. It could happen.
In
Right.
placenta previa also.
Placenta previa also.
Yeah.
We can expect PPH.
Yes.
Right. In anemia, can PPH be common in anemia?
Yes, and anemia, which is quite common.
And of course, little loss of blood could also be more potentially dangerous. That's another thing. But otherwise, anemia could also be a high risk. And anemia would be very common in our country, I suppose,
Yes,
health and
anemia is
nutrition.
more
Yeah,
common
yeah,
in our
two
country.
countries. The next question, Sachin. When would you prefer carbetocin over oxytocin for prevention of PPH? Any specific place where you prefer carbetocin?
Yeah. Nowadays, everywhere we are using it.
We are using the carbetocin everywhere in proper, not home delivery, but
Yeah,
hospital delivery.
correct. Are home deliveries common these days, madam? Or they are events of past?
No. Sometimes Asha worker can
Hmm.
do home delivery also.
Okay. Oh. And
So
those
we
cases, I
use in
suppose it's better
hospital.
to give. In those cases, I suppose it's better to give carbetocin. Carbetocin would have an
This
advantage because
tablet
of
misoprostol may be used by them.
oh, you give straight away one injection and it's over.
Use a tablet misoprostol
Correct.
prevent the PPH by them.
Next one, Sachin. Can we use carbetocin in case of retained placenta?
Yeah.
Yes, we can use in this also retained placenta.
But madam, if the uterus contracts, my question is that would placenta come out? Would the os be closed, or the os is not closed and the placenta would come out?
Uh,
Nee.
retain placenta sometimes.
Os is open, then we can use.
Then we can use, correct. Then the placenta can come out, be
Yes.
expelled. Otherwise, it cannot because it will be
Nee. Enclosed os, no.
misclosed, correct. So whether we use carbetocin in retained placenta or not would depend on os, whether it's closed or
Os.
whether it's
Depend
open.
on the os.
Yes, correct. Next one, Sachin. This is a question which has come across the country, very important. Can we use carbetocin in Rh negative mothers? And many doctors want to know this. We know the Rh, the whole issue.
Actually, we have not used in Rh negative mother.
Okay.
After Googling, we have found can be used in Rh negative mother.
And many people said so, because Rh negative is an entirely different dimension, we know, because of the antibodies going here and there. And yes. Yes, Sachin. Can a doctor use carbetocin for prevention of PPH if oxytocin is used for induction? I think oxytocin is routinely used for labor induction, for
Yes.
augmentation. Then can the doctor use carbetocin? Because both of them seem to act on the same receptors.
Same.
Can you use carbetocin? Would it work in the same way?
Correct.
Yes, we can use.
Yeah, we can use, and it would give us similar results.
Yes.
because it is also analog of oxytocin.
Correct,
Carbetocin.
correct. So it would work in those cases also.
Yeah,
So if a doctor has used oxytocin for induction of labor, he can very well use carbetocin
very
for
well
prevention.
used.
Sachin, in which cases would you prefer IV route over IM? I saw in the cases sometimes IV was used, sometimes IM was used. Is it that you prefer IV over IM in some of the cases?
IVs routinely we use IV,
IV. Okay.
because instant results are there, but not sustained.
Okay.
The half-life 40 minutes only.
Yeah.
When
Yeah.
we need a longer duration to act, so intramuscular route is much better.
Like in which cases, madam? Longer duration.
Actually, I have used only one case where I think she need longer prevention. कभी कभी पेशेंट्स जो फीमेल अगेन फीमेल चाइल्ड हो या उनके
Correct.
घर के लोगों से मिलने के बाद
Oh.
एप्रीहेंशन दे हैव अगेन पीपीएच
Oh yes. That can happen. Huh?
होता है कई बार, तो उस केस में मुझे प्रेफर किया मैंने कि आईएम लगा दिया तो लंबे से
Duration. The duration of effect will be longer.
इमीडिएट पीपीएच तो था नहीं, लेकिन बाद में भी आगे नहीं हो, दैट केस में भी आई एम बेटर.
So when you need a longer duration of effect, intramuscular route is preferred over IM. Next one, Sachin. If the patient is not responding adequately with carbetocin, what additional uterotonics that can be used? In your case, you have used oxytocin despite using carbetocin. Is there anything else that can be used if patient is not responding adequately?
Tranexamic acid also,
Okay.
and carboprost in some cases.
Carboprost also. Carboprost, how is the tolerability of carboprost, madam?
At the time of PPH, tolerability sustained.
That is correct. That is correct. We are least bothered about the side effects. That's one place, where only efficacy matters and speed of efficacy matters.
Yes.
That's correct. But tranexamic acid works wonders, in all these cases.
Yes.
It acts very fast and can. So if patient is not responding adequately with carbetocin, you will prefer a tranexamic acid over other uterotonics. Of course, you will use uterotonics, but straight away prefer tranexamic acid. The next one, Sachin. Now, this is a general question. What are the advantages over oxytocin, misoprostol, carboprost, and methyl ergometrin? Over oxytocin, we'll go one by one. Carbetocin advantage over oxytocin.
In short duration of action, oxytocin.
Oxytocin has got short duration of action. And possibly you have to put a drip as against.
Infusion में ही दे सकते हैं. Yeah. Carbetocin direct IV आपने shoot.
Correct. And a cold chain is also an issue.
Yes, cold chain.
With carbetocin is stable up to 30 degrees. So yes, so, I mean, in our country that also matters. And I suppose even in the interiors where you may not have good facilities for IV drip, etc., this short carbetocin would, I mean, one single injection would make that difference, which can be given even IV and IM.
Yes.
Misoprostol, advantage of carbetocin over misoprostol.
Misoprostol sublingually.
Yeah.
Sublingual or vaginal, yeah, rectal also, but duration
of action
is later.
Duration is not long.
Yes.
Not started, even not started immediately.
Oh, yes.
Later onset of action.
Okay, so slow onset of action principle as compared to carbetocin.
Yes.
And carboprost, we discussed that. Methyl ergometrin.
In this, side effects are more in methyl ergometrin, and it should be avoided in cardiac disease also.
Yes, hypertension. Is there a spurt in blood pressure immediately as we give methyl ergometrin?
Rise in blood pressure also.
Yeah, immediately it occurs. No?
Yes. It is not given in RS negative also.
Yeah. Madam, you are unaudible. Your voice is breaking.
Methyl ergometrin, we have not used in RH negative also.
Okay. And principally cardiac side effects are more with methyl ergometrin as compared to carbetocin.
Yes.
Next question, Sachin. Should carbetocin be kept as a reserve drug or should be a first line?
I think first line.
First line. No? Yeah, prevent the disaster, like, try to prevent the unexpected.
Yeah.
Or you can I mean, so it's better that it's used as a first line so that there's nothing wrong in using it as a first line unless there are some cross contraindications.
Now we are using first line.
First line. No? Yeah. And principally, as madam says, where you want a longer duration of effect, you use intramuscular and okay. The next question, Sachin. How would you compare adverse effect? Now, this is more of a theory, as madam rightly said, in PPH management, we don't worry about adverse effects. But then also, if you compare adverse effects or contraindication of carbetocin or oxytocin and other uterotonics, hemodynamic profile, overall, how you will place it?
Carbetocin also in this nausea, vomiting.
Carbetocin gives a
Yeah.
okay.
Sometimes it is even nausea, vomiting,
Headache also.
headache also.
Okay.
But they are not major side effects.
Not major side effects.
Not major.
And any effect on ADH as oxytocin has? Retention of fluid?
No, not at all.
Not at all.
Huh.
Because oxytocin
sometimes they are maybe seen in the oxytocin.
Oxytocin.
Otherwise, tolerability is good. There is no change in blood pressure parameter or heart rate, etc.
Mhm.
The next one, Sachin. How would you conclude? To conclude efficacy, tolerability of carbetocin vis-a-vis other uterotonics?
Because there is least side effects, so carbetocin is definitely better, and having a good contractions and sustained effect. Like the oxytocin, आपका तभी तक वर्क करता है जब तक आईवी इन्फ्यूजन कंटिन्यू रहता है.
बराबर.
हाँ, इसका कार्बिटोसिन का हाफ लाइफ ही 40 मिनट्स में, तो ये सस्टेन इसका इफेक्ट रहता है. एक बार यस आईवी लगाने के बाद एटलीस्ट 1 आवर तक तो इसका रहता है मेंटेन.
The secondary PPH will essentially occur 24 hours later after this, or how do you rate a secondary PPH? How soon or how late it occurs?
The secondary PPH, we see lacerations also.
Okay.
Any other laceration, any other cause, coagulability
disorders.
Yeah, disorders. Then we decide.
Then we decide. And sometimes I suppose the patient may have to be taken to theatre also in those cases.
Yes.
Yes, Sachin. I think that is all from our side. It was very good clinical insights, So overall, you'll rate that one should use carbetocin as a first line, principally to avoid potential disaster or to avoid side effects or PPH. But of course, carbetocin is used only for prophylaxis of PPH and not for management of PPH. Management will require different type of drugs.
Yes.
We had lovely insights, madam, from both of you. This is a clinical experience which helps a lot. So thank you all. And thanks all the participating doctors who took time from their busy schedule and commitments and attended this session. Thank you, marketing team Hitro, for conceptualizing and organizing this webinar. As you'll all agree with me, this type of webinar requires coordination from the field team. And thank you, Hitro field people, for the super coordination. Last but not the least, thank you, IT team Hitro, for your support and guidance in all technology-related matters. Thanks once again. Thank you, madam. And once again, signing off. Thank you.
Thank you.
Thank you, ma'am.
Thank you.
Yeah. Have a nice day.